Good evening. Hey guys. Hi everybody. Maleke. I've got Shia, Mashudu, Connie, Zekone, Kumin, Nades Deploy, The Closet Castle, Leboli. Welcome guys, welcome. So we are having a great conversation tonight, and we are chatting to an amazing couple, but they're also fertility specialists and embryologists from Ghana. So we're just going to wait for them to go live, also come on board, so we can add them to here. Maggie, Kanisa, welcome guys, welcome. Thank you for joining us tonight. It's Wednesday evening. It is Fertility Talk on Instagram. So hi Jenny, always seeing Jenny. Hi Jenny, Noma, Googs, welcome. Nice of you guys to join us. We're talking about infertility in Africa. It's a big topic, guys. It's an important topic, because the reason why we have fertility solutions and we have all these talks and stuff is because of exactly that, the infertility in Africa, and about trying to create awareness around this problem in Africa, and what women are going through. And a lot of people don't know what women go through, and only if you're going through it or you've been through it would you understand. Hi Jenny. So yeah, I'm just gonna wait for them to come. I hope they come on. Because they're in Ghana, I really have no idea what the time difference is. Fidos, hi Fidos, Phyllis, hi Phyllis. So we're just hoping that they see that I'm online and they get the notification and we can go live with them. So as I was saying, that we are chatting to Dr. Rex and Diane. Diane is an embryologist in Ghana from the Fertility Advisors. And I'm just hoping, hi Dee. Dee's always here. Hi Dee. Thank you, Dee, for joining us always. So I'm just gonna hope that the doctors come on, and we obviously can't be certain that they will get the message, and there's no way of me WhatsApping them because they're not here in South Africa. Not that you can't, but okay. So I'm just hoping. I'm hoping that they come on. So okay, but if they come on, they come on. But otherwise, I'm just going to take the time out to chat to you ladies. So infertility in Africa itself, it's a big topic. Reason being is a lot of women are almost like they're not allowed to talk about it. They're not allowed to it's seen as a taboo subject. It's seen as something that if you are suffering from infertility, and if you are starting to conceive, and after the first year almost, or the first few months, or the first year, if you don't come back and tell your family that you're pregnant, or you're expecting or something, the woman, a lot of times the women get looked at as if there's something wrong with her. Yay. Advisor, yeah. So that's why we're having this conversation. So I'm just gonna invite them now. So let's see. Fertility Advisors, yeah. And embryologist Diane, his wife, and we're just gonna wait for them to come on. This is exciting. So they're joining. They have joined. It says they've joined. Okay, give it a couple of minutes. Yeah, they get to come on. Okay, I think it's trying to do something. Excuse me, sorry guys. Is it now? Oh, they're trying to join. Just invite and let's see what's happening. I invited them. Yay! Hi,
Hello.
guys.
Hello.
Hi, how are you?
We're good. How about
Good.
you?
I'm doing very, very well this evening. I'm so excited to have you guys, to chat to you guys. I'm always watching your posts. You guys have an amazing page. Our colors are very aligned. Loving it. So I'm always
Thank
watching
you.
what you guys say in the talks and stuff like that. Um, So, welcome to Fertility Talk. We do this every Wednesday, on if not on a Friday as well, on our Facebook page. So I'm really, really happy and excited to have you guys join us. Thank you.
Yeah, likewise. Thank you very much.
It's a pleasure.
Yes.
Tell me, what is the sorry, Dr. Rex and Diane. So it's Dr. Rex and Diane from the Fertility Advisors. I actually feel like this thing is a bit too high for me. Sorry. Let's do that. There we go. Yeah. Dr. Rex and Diane from Fertility Advisors. And yeah, what is the time difference, by the way? Is it on the same? Are we on the same timeline? Or I hope it's not early hours of the morning there or something?
2 hours. Yes. You guys lead us by 2 hours.
Sorry?
You're leading us by 2 hours.
Oh, by 2 hours. Okay.
Yeah.
Okay. So what was I going to say? We're going to just get right into it. Maybe if you guys can just take a few minutes and just introduce yourself, who you are, where you're from.
I knew you'd do that. Okay, so I'm Diane, Diana Meadow. I'm a clinical embryologist, um, living and working in Ghana. And yeah, nothing much to it. Okay, how long have I been in India? 7 years, like 6, 7 years now practicing.
Okay.
Yeah.
And you, Dr. Rex? Okay. It's sorry, the sound is just you're very, very soft, so I can hardly hear you guys. Okay. 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 I'm sorry, but everybody's posting and saying that they cannot hear you at all, Dr. Rex.
Oh,
I don't know if you want to turn up your sound on that side.
Is that any better?
yeah.
That's much better, much better.
Much better. Okay. Okay. That's
Thank
great.
you.
So
Okay.
yeah, sorry. Medical doctor working here in Ghana as well. Just partnering with her, doing things, trying to create awareness about infertility in Africa. Just with what we saw when we started working in the field all these years, and decided to try and do something about it too. So that's just a bit about ourselves.
Okay, great. Okay, so this topic tonight we're talking about infertility in Africa. It's an important topic, and I said it's a big topic, everyone, because it's the reason why we are doing what we are doing. It's the reason why you have a social media page and posting about it. The reason why I do it as well, and a whole lot of people out there are doing it, because there isn't a lot of talk. It's still almost a taboo subject in Africa, I would say, and around Africa and in social settings as well. There's still this big, huge taboo thing about you're not allowed to talk about it. There's something wrong with you if you haven't conceived after a year of marriage or 2 years of marriage. There's something wrong. I mean, I've heard a lot of stories of there's something wrong with the witches doing something. If there's something, if you haven't conceived them, and we might laugh about it or giggle about it, but that is exactly what is happening. I did this topic about a year ago with another doctor as well, and I mean I heard horror stories of what some women have to deal with. One of the things that I've heard was a woman's being said that she doesn't get called by a Mrs., she gets called by Mr. because they're not allowed to call her Mrs. because a woman conceives, and if she's not conceiving, then how can she be a woman? So this is the type of thing that women deal with all over. And I'm wondering, is it the same in Ghana? Is it on a higher level in Ghana? What can you tell me?
Yeah, very, very much.
I mean, part of the reason why we started this is because we were encountering a lot of patients, a lot of women.
Sorry, guys, I'm sorry, but your sound is really, yeah.
Sound is terrible today.
Yeah, there we go.
Okay, great. Yes. So as I was saying, that's actually the reason why we started, because a lot of women, especially, like it's something that it's everywhere, but then it's more impactful in Africa, I would say, because of the social cultural reasons as to why a woman cannot give birth. I mean, it's considered a social stigma. So the impact felt in Africa is more. And I mean, we face it in Ghana here.
Yeah, I mean, yeah, definitely. I mean, you mentioned some of the things that, and the same thing in South Africa as it is here. After a woman gotten married, if after some years she's not producing a child, they're just gonna, there's all this, is it witchcraft, or why is she doing this? Why is the baby not coming? There are all these other cultural and traditional things that come in, right? And it's just all on account of a lack of education, and people having access to information to know that, oh no, it's actually a medical condition. And it's actually maybe not even the woman's fault. It might be the man's fault. Yeah, or witchcraft, So
absolutely.
Yeah, so definitely it's something that's it's the same. I think overall, as we've spoken and had contact with other people also in Nigeria, people in Kenya, it's the same thing we're seeing across board. And as you even mentioned it with an essay as well too, it's just something that as a continent, specifically even sub-Saharan Africa, as a continent, there's so much more awareness that has to be created in this field, for people to actually know that, okay, yes, this is something that is medically there. This is something that I'm not the only one dealing with it. This is something that there is help. We can, look out and get help to be able to solve these issues.
Absolutely. And most importantly thing that you said was that it's a medical condition. Just the same way diabetes is a medical condition, and you have all these other heart conditions. So is infertility as well. Do you have any stats on fertility in Africa itself?
Any statistics on infertility in Africa? So there have been a few papers that have tried to do that, but I think I can't speak so much. I think SA, you guys actually do much better than the rest of the world. Well, the rest of Africa. The rest of Africa. But that's been one of the bigger issues. It's about data, right? So people are seeking help from avenues where data is not being collected. So what ends up presenting, and there's the misconception of the Black woman or the African woman being very fertile. But yes, you see women being fertile, having para 6, para 7, giving birth to multiple children. But the other side of it, because the social aspect of it, people aren't reporting to the clinics. People are staying married for 10 years. So the data sadly is very lacking. There are some papers that are trying to come up to be able to do these meta-analysis studies, to be able to pool papers together, to be able to actually get a better idea. But a better figure on it. But it's something that is definitely there. It's something that's definitely there that needs more attention, if I should say.
Absolutely. What are these, I think we also spoke about that. What has been done in Africa for women with regards to fertility? Or especially, let's talk about Ghana itself. What is being done there? What type of access to fertility treatments do women have in Ghana? And especially financial, there's financial sitting around it as well.
That's actually.
Do you want to take it?
Oh, we can both discuss. You can go ahead.
So I think luckily within Africa, in Ghana specifically, in the early 90s, that's when we had our first IVF clinic and first IVF baby. Since the early 90s to currently 2022, we are roughly around 32 IVF clinics.
Wow.
So, and this does not even count the other clinics that might be being able to do other procedures such as maybe an IUI. So, not partaking fully in IVF services, but fertility treatments of some sort. So I think
that's more than here in South. Sorry, I think it's more than here in South Africa. I think we are staying predicted, but I think it's about 26 clinics here.
Wow. No, Ghana and Nigeria have
we have quite a number.
Yeah. It's a field that has I think has boomed a lot.
Yes.
And for the clinician's point of view, I think if we're being very realistic, it's not everybody who's empathetic with regard to this field. Other people have other reasons for opening up IVF clinics. So from their point of view within the field, it's been something that it's a lucrative business for them to get into. So there've been more clinics opening up as more attention is drawn to the issues. I think for women, luckily, I think one of the most important things that's being done is education and awareness for them to know. We have women who contact us, and it's amazing. They'll be telling us about, when I'm with my man, it seems like the color of his semen is a bit different than I've seen it before, and I think he might need a semen analysis, right? And so women are being empowered more and more, which is very important. I think in any society, once you can empower a woman, trust me, she can lead the nation.
Exactly.
Like, if you leave it to men, forget about it. Like, health-seeking behaviors, forget about it.
But it's not really much here in Ghana. That's actually why we started this page, because there are a lot of there are a lot of other, like maybe for young girls, menstruation and menstrual hygiene and stuff, but for issues relating to infertility, there aren't much awareness groups. There was just this one that I think was talking about PCOS or something, and that's it. But the government, for instance, doesn't have such measures that have been put in place for such couples. So that's why we decided to do this, just to help women. And a lot of women have been reaching out to us, men too. That's something that makes us very happy. The gentlemen too are reaching out to us. Yes, and a lot of them also refer our page, like, can you check out this page? Maybe you're going through this issue. So more of such pages or more of such groups are important in our society, because it will help people to realize that you can talk about infertility. It's not something that has to be hidden or discussed. It's something that is a problem. It's a disease. So you can talk about it, like you talk about diabetes, you talk about pressure. Why not talk about infertility?
I was actually going to one of my next questions were are men stepping forward? And that has been happening on my side as well. I'm getting a lot of men contacting me. I'm getting men contact me wanting to purchase products to assist with their semen. And it's nice that men are taking this step, or men are phoning and asking, where can I get a semen analysis, and not just leaving it up to women. So I'm glad you answered the question that I had, was, are men stepping forward? And they're not only thinking that it's just a woman's problem.
No, it is. And if you look at infertility worldwide, if you about roughly 30% of the time, it's actually a male factor, right? So and that's, I think it goes back to our whole talk of infertility in Africa, because sadly fertility is the woman. That's always what it's made out to be. Fertility is the woman. So if there's an issue and there's any infertility, it's the woman. Meanwhile, that's not the case. So you sometimes have difficulties when you even have women contacting you and just trying to drag their partners in to be able to just, for the man, the most basic investigation that he can get done is just a semen analysis. For the woman, there's so much more to do. An HSG, check if her tubes are patent, check her hormonal profile, go through her menses, all these things. But for a guy, it's like, hey, just show up one day, do a semen analysis, and that's it. Like, we can be done with
Yeah.
it, but even at that, right, it's so difficult. And I think in general with infertility in Africa, yeah, I think with our followers, 91% are female.
Yeah, women.
Yeah, are
Yeah.
women, and only 10% are guys. But hopefully, yes, more and more as we empower women with you know, fertility issues, we equally hopefully draw men in too. That way they can also reach out and they can also know that, hey, it might actually not be my wife's fault. I think new
Yeah.
generations are more educated, so we're not backward thinking anymore, and hopefully, yeah, this can open up some doors for people.
Absolutely. What are the most common problems you are seeing in Ghana with regards to infertility? Like, what is the most common issue medically?
Okay, medically, we've had a lot of quite tubal factors. Yeah, tubal factors, and that goes back, and it's actually something that's important as to part of the awareness early on, right? Because repeated infections in your youth, it's going to cause PID, and that's just going to cause adhesions, and that's going to cause tubal blockage. So tubal factor tends to be one of the major issues for the female aspect, you know, if you're looking at female infertility, that we've come across as we've worked with clients. Hormonal issues too tend to come in. We do see quite a number of PCOS patients, yeah, as well. But tubal has been, with infections, has been the most that we've seen. Yeah, with women.
With men is varicocele.
Varicocele has been there, and oligospermia. Yeah.
Okay. Then financially, what is available to women when it comes to fertility treatments? Is there, do you guys have like a government funded programs or anything like that for women in Ghana?
No.
Nothing.
No. So
there's nowhere they can go to, you know, if they're not financially or have a bit of finance to go and do these tests or anything.
No, so generally there are government hospitals, right? But there's not, speaking for Ghana, there's not a single government hospital that, as of now, has an IVF lab or an IVF setup. There's no government. All IVF, private. Yeah, they're all private hospitals. That being said, it doesn't mean that a woman here in Ghana, or I'm sure that'll be the same case elsewhere. I mean, you're walking into a clinic, maybe a government facility, where you're going to meet an obstetrician gynecologist if you have any gynecological issue, if you're suffering from subfertility or infertility. And they're going to be experienced in one way or another to be able to help you. The question becomes, how big is the problem and what avenue do they have, right? Sometimes, as we mentioned, it might be a male factor that maybe an IUI might be able to help. That doesn't need a full setup of an IVF lab. Sometimes it just might need some ovulation induction with a little training, and some timed intercourse, teaching the woman how to really time her cycle, look out, getting her some ovulation predictor kits, getting her to look out for when she's fertile. So there are avenues available, but if you're talking at the end of the day on the grand scheme that how many women have access to IVF financially on the government side of things, it's zero. It doesn't exist whatsoever. It's strictly private at that point. Out of pocket.
Okay, I've got one final question, which is my biggest question, I think, and it's also a question that I need to answer as well, is what are you doing on your side? Or what do you want to do on your side to be able to make to educate women more around infertility, or couples or society around infertility, that it's not something that the woman did. It's not that she's not more enough of a woman to bear kids, to conceive naturally. What are we doing in the situation, or what is your plans, or what do you want to do?
Okay.
It's something that you actually have to think about. I'm sorry to spring this on you, but I mean, maybe you just have a tiny idea of it.
So if as to what more can be done in terms of
Yeah.
being able to help women in this.
I think in our society or generally in Africa?
Generally in Africa itself, yeah.
I think it all goes back. There's something that I keep learning in the clinic, in our setting with women who are, and I think the greatest word that we're always trying to use for women is empowerment. And to empower women is to be able to, to be able to give her all the access and information that she needs to be able to take an informed decision. It's sad that sometimes, we deal with some, patients sometimes who are from, not very good financial backgrounds. And even for them to report to the hospital, they have to wait for their husband's permission to give them money to be able to come. And some of these women are pregnant and they need to be able to, have care. But I think what we're trying to do, and the most that we're trying to do, is to basically empower women, right? Because I think, and through our channel, the sad thing that doesn't work so well here in Africa is support groups. Because people want to be private with their issues. But it's something that we hope in the future society would open up more, that people can have support groups. That way they can see that, oh, okay, yeah, truly, I'm not the only one going through this. Like, there are 50 other women with this problem just in my, little city or within my neighborhood, that when we can get more support groups, they can feel more empowered. They can know that, okay, it's truly not them. And trust me, when you get two women talking together, or a group of them talking together, they can conquer the world. So I think that's one.
Yes, and I mean, if, for instance, if government also could maybe implement such educative forums for, especially starting at the adolescent age, at the adolescent stage in secondary high schools, about reproductive health. That way, a lot of young ladies will just be taking the emergency contraceptives, sleeping. It all comes down from the roots from so that way it's like to build upon it, and then that would help the society, that would help the country as a whole, and then Africa as a whole. To have such educative
platforms and policies and
That's absolute great ideas, guys. I love it. I asked that question on purpose, and I try and ask it to as many people as possible, because at the end of the day, like we said, we are here doing this to educate women, and we just, I just feel for these women out there that's got, they don't know that they've actually got a problem. The families don't know that it's a medical issue. So they sit back and they wait and they wait and they wait. And they go through unspeakable things with their families. So that is what we're trying to at some point, have that not happen to them. So I just want to say thank you to you guys. I really, really appreciate you taking the time out to doing this talk. It was wonderful. I really hope we can do this again sometime.
Yes, definitely.
Thank you so much for having us. It's a pleasure. Thank you so much.
It's a pleasure. Have a great evening, guys. See you then. Bye.
Bye.
Bye.